The examination of the prostate and therapy of benign and malignant diseases. The prostate is an exocrine tubule alveolar gland with fibromuscular capsule and smooth muscle from the urinary bladder wall. It is androgen dependent and has gradual growth up to 11 years and then involution. The prostate fluid makes up 90% of the ejaculate. The clinical signs of all prostatic diseases are intermittent preputral bloody discharge without urination, hematuria at the end of urination, and dysuria is uncommon. Hematospermia happens first, and then the semen quality has decreased motility due to morphology and tail abnormalities. Constipation and tenesmus can happen through a perineal hernia. Animals can get lameness, paresis, and hind limb edema, and they can get fever and decreased body conditioning. For the diagnosis, do a digital transrectal palpation. Check the size, shape, and surface. The prostate should be smooth, symmetrical, and have a dorsal median groove, and it should not be painful. If it is enlarged, check for a perineal hernia. It's quite frequent. And if it's asymmetric, check the parenchymal alterations. And if it's painful, it could be prostatitis or carcinoma. You can also check through abdominal palpation and ultrasound. In the sagittal plane, it seems oval, and in the transverse plane, it seems rounded and bilobed. During an ultrasound, we need to look out for cysts, tumours, and prostatitis and hyperplasia and tumours. When doing an X-ray, if it's enlarged, it could be over 70% of the pubal sacral promontory distance. And to get a sample from the prostate, you can do an ultrasound-guided fine needle aspiration, or do a semen collection in the third fraction, or a biopsy for histopathology if you suspect cancer. The markers are canine prostate-specific arginine esterase. The treatments for benign prostate hyperplasia can be castration, deslorelin, or finasteride. In the case of metaplasia, you can give castration. In the case of prostatitis, you can do castration and finasteride. And if there's neoplasia, have euthanasia. 75% mortality occurs within 10 days. In benign prostate hyperplasia, it's spontaneous, it's age-related. It happens in male dogs that are 9 years old and intact. When they get older, their testosterone decreases and their E2 to testosterone level increases, so they have too much E2. And when they get older, their 5A reductase enzyme increases, which causes dihydrotestosterone to increase, which leads to hyperplasia and cyst formation. The solutions are surgical castration. The size will decrease in 1 to 2 weeks afterwards. Or you can have a chemical castration with deslorelin. The size decreases around 7 to 11 months. Or for conservative treatment, to preserve the fertility, you can have finasteride or oasterone acetate. Prostate metaplasia is due to estrogen. The Sertoli cells develop squamous cell metaplasia, and it predisposes them to ascending infections and cysts. The solution is castration. Prostatitis occurs mostly in active intact dogs, and benign prostate hyperplasia predisposes them. It's mostly a septic form of E. coli or streptococcus or staphylococcus. You can treat with antibiotics such as enrofloxacin, or have a surgical castration or use finasteride. In the case of prostate cysts, use finasteride or castration. In the case of a prostate abscess, use castration or antibiotics and surgery. And in the case of cancer, it's very uncommon. It's around less than 1% of 10-year-old dogs, and they're most often transial cell carcinomas. What you should do is euthanasia, because 75% mortality occurs within 10 days.